half that it was folded into when it came out. So I'm just gonna kind of put it on his stump. Okay, so this is if his arm got ripped off. My partner's gonna help hold it in place. And now I'm gonna tape, just kind of loosely tape it on. And loosely, okay? I'm not trying to like kill at this point, because at this point I'm not tourniqueting, okay? If I needed to tourniquet, it doesn't really matter how tight I tape this, okay?
Yeah.
I'm here to tape.
In what instance would you use a tourniquet versus a...
If it's not controlled bleeding.
Oh, right.
So when you open up a cravat all the way, if you guys haven't done it yet, this is what it looks like. It looks like a triangle. So these are also called triangular bandages or triangle bandages. So you're going to open it up all the way. You're not going to lay it on the dirty floor, but so you all can see what I'm doing that. And you're going to fold it over once from the end so that you kind of have a like a little ledge to work with. And this ledge is going to be kind of what I'm going to be tying with. So what I'm going to do now is it's like you're tying a bandana on, if you wear bandanas that you tuck the tails in. So I'm basically going to lay it over, okay? And then what I'm going to do is I'm going to scoop, let me get it on enough. And then I'm going to scoop the tail up in it, okay? Just like that, so that the tail is tucked in. And I'm going to tie it, and I just tied it loose with an overhand knot. I can do it a second tuck to actually get the surgeons. And then I can tie my safety. And I can tuck my tails. Okay. Now this should stay on, okay? It's at least a little bit more secure than it was. You still have to be gentle though, because this still can come right off, okay? There's obviously nowhere to check pulse, motor, and sensory, your circulation below, right? Because it's an amputation. So any questions about this? Yeah.
So if you were having uncontrolled bleeding, you would tourniquet first and then do that?
Mm-hmm. Yeah. I mean, you're going to obviously try to do direct pressure and to put a dressing on and see if that controls the bleeding. But if it doesn't, if it's truly uncontrolled bleeding because, you know, the vessels are too large, etc., you're going to go right to a tourniquet. And that does happen sometimes. Amputations kind of go one or the other way.
And if you showed up on scene and there was obviously a liter of blood on the floor, you would just go straight to a tourniquet.
So yeah, if it's obvious profuse bleeding, you're going to go right to a tourniquet. You're not going to fuss. And while you're going to that, please, somebody hold direct pressure, okay? Because that's better than nothing, okay? All right, grab some trauma pads.